Good evening. Thanks for joining us with the ARC of Northern Virginia, the Autism Society of Northern Virginia, and our partners' Conversation with Candidates. I'd like to introduce our longtime board member and advocate volunteer, Sharon Cummings, to lead us off with some words for this evening, followed by her son, Connor.
Welcome to the 2024 Senate Congressional Discussion on Developmental Disability Issues. We are happy to have Senator Kaine with us today. We want to thank the ARC of Northern Virginia, the Autism Society of Northern Virginia, Disability Resource Center, Moms in Motion, Independence Center of Northern Virginia, Virginia Autism Project, Didlake, Autism Society of Tidewater, Autism Society of Central Virginia, Spark, Rev Up Virginia, and the ARC of Loudoun. And special thanks to CRI and the ARC of the Greater Prince William. Also, thank you to each and every one of you watching and recognizing the importance of our vote. Now, I am proud to introduce my son, Connor, who will say a few words on the logistics, and then the amazing Lucy Beadnell will moderate the questions.
My name is Connor Cummings. I am a self-advocate and proud to be autistic. Please remember that this is a sensory-friendly forum. Talk about what you can and have done for individuals and families with disabilities. Share your disability experiences and plans, if elected. Please concentrate only on you. Thank you for respecting the sensory-friendly instructions. This is your opportunity to answer our questions and to hear our stories, not just today, but every day you are in office. To all of you watching, these candidates are here because they care. This is our opportunity to hear a disability platform, to help ensure that our representatives include us in their decision-making, not just mentioned, but a seat at the table. November 5th or prior, you can vote for the candidates that you feel are best for your needs and support. Remember to always vote because our voice matters. Now, here is Lucy to start the questions.
Thank you so much, Connor. You always give the perfect introduction. So we'll put 15 minutes on the clock. And Senator Kaine, we would love to hear from you first with just some words of introduction. Anything you would like us to know about your past work on disability issues or a little bit about the work you do, and then we'll move into some other questions.
Lucy, thank you. And I really appreciate the opportunity to be with you today. And I was with Connor and Sharon the other night. It's good to see you guys again. For many years, before I was in elected office, I was a civil rights lawyer bringing discrimination cases against those who had discriminated against people in housing. And a lot of my work was for those who had been discriminated against on the grounds of disability. When I was lieutenant governor of Virginia, I was the chairman of the Virginia Disability Commission. And now I have the good fortune in the Senate of being on the Health, Education, Labor, and Pension Committee, which is the primary committee in the Senate that works on health and disability related issues. And I always try very hard to have good dialogue with our community to make sure that people feel included and heard as we're looking at policy. Things that I've done in the Senate on that committee I'm proud of. I was the deciding vote to save the Affordable Care Act in August of 2017. We saved it by one vote. And disability advocates around the state, particularly young people, were very, very helpful in this because the effort was to not only repeal the Affordable Care Act, but to dramatically reduce Medicaid expenditures in a way that would have hurt folks with disabilities, especially youngsters. I have been a significant proponent of better funding and training for our home-based direct care workforce. And I really focus a lot on the workforce-related issues. I had a sizable provision that I tried to get included in the Inflation Reduction Act, which originally was called Build Back Better, but we were not able to convince all of my colleagues on the Democratic side to go along, and so we were not able to include that. But I have significant efforts underway to expand home healthcare workforce, better training, better compensation for our home healthcare workforce. And I would say that's probably the area where I am most focused, is the workforce side of this important area. And the last thing I'll say before questions is I continue to really focus on civil rights related issues around folks with disabilities to make sure that they're fully included, whether it's education, housing, public accommodations, employment. And I'm even in recent years, because I'm dealing with a persistent long COVID symptom, I'm doing a lot of work with the long COVID community who are grappling with a whole set of issues. For example, can they qualify for Social Security disability? Can they get reasonable accommodations in their workforce to deal with their long COVID conditions? So I'm really happy to be with you guys at the ARC today and look forward to the discussion.
We couldn't be happier to be talking with you, and we'll dive right into some of those issues that you mentioned. I imagine this will be familiar, as it's been a long-standing topic for debate in Congress, but the Supplemental Security Income, or SSI program, provides basic support for necessities like rent and food. It offers $943 a month at maximum. And it's got a lot of rules tied to eligibility that make it very difficult for users to get out of poverty. It has a $2,000 total asset limit that was last updated in 1989 when I was but a wee preschooler. So those assets include money in the bank, 401ks, even that your employer saved for you that you didn't. And we penalize people in these programs for getting married by either reducing the total assets the couple can have or ending their eligibility completely. We would love to hear about your thoughts on the bipartisan SSI Savings Penalty Elimination Act that raises that per person savings and asset limits and removes marriage penalties, or any other thoughts on how to better improve this program.
Thank you for this. Yeah, this is a very serious inequity, and the fact that it hadn't been updated since 1989 really hurts a lot of folks who could use this assistance. The bill that you ask about is a bill, the concept of it, I completely support. They're only adding sponsors two at a time. We call it a Noah's Ark phenomenon, that they won't let another Democratic co-sponsor on until they can find another Republican co-sponsor. But I am a co-sponsor of a very similar bill called the Asset Act, which was filed by Chris Coons and Sherrod Brown, which would eliminate the federal asset limits for SSI, as well as other programs like TANF, SNAP, and LIHEAP. So I am a named co-sponsor of a similar piece of legislation, and would love to work with advocates to either get the first bill passed or the one that I am a co-sponsor of.
We would love to see some movement on that. That's clearly long overdue. And so now we'll dive into something that you referenced in your opening remarks, both the challenge of the disability community to get home and community-based services, right? To even give access to those caregivers who do things like help people get around the community, bathe, rest, get out of bed. These are programs that support our veterans, people aging in place, people with traumatic brain injuries, people, as you mentioned, perhaps with long COVID, and people with developmental disabilities. Around the country, we know about 800,000 people are waiting to get access to programs like these, even after they've been deemed eligible. And about 16,000 of that group lives in Virginia. This has been a long-standing problem. So we see big challenges with families struggling to hold down jobs, keep care, and keep people healthy and stable. Over the last few years, there have been a few efforts by Congress to address this at a federal level, as opposed to leaving so much discretion to the states. And we would love your thoughts on how to, as a nation, move forward on tackling this shortage of HCBS options.
We really need to do this. I first became very aware of the HCBS shortages when I was chairman of the Disability Commission during my time as lieutenant governor. And we had high hopes when we were working on what became the Inflation Reduction Act in 2023. We really hoped that we might be able to include a robust support for home-based services, because, as you point out, it's more than 800,000 nationally, and nearly 16,000 in Virginia are people who are eligible for these services, but they're on waiting lists because of inadequate funding support. We fell short, regrettably, when we were working on the Inflation Reduction Act, because I had a couple of colleagues who wanted to restrict the bill only to clean energy innovation and prescription drug price reductions. Both of those are fantastic goals, obviously, but we couldn't include the robust provision for our home-based workers and those who need their services that we hope to. But I am going to use my capacity on the Health, Education, Labor, Pension Committee to continue to promote it, and then especially to really focus on this issue of a shortage in our direct care workforce. I know you all know that a lot of our direct care workforce is pretty senior. There's going to be a lot of retirements. I helped when I was governor, I helped our direct care workforce essentially organize so that they could seek from our legislature higher reimbursement, which is one way to keep more people in the field. But we also have to devise strategies to get new people to come into the workforce. And that's likely to be through things like public service loan forgiveness, training programs in our community college and other educational institutions. And I'd very much like to work with the community on those solutions.
We would love to see that. There's a big need, right? Because we often see people who finally get home and community-based services after years and years of waiting, only to find they can't actually buy a caregiver with the reimbursement rate that we're paying. So I'll move on actually to a related employment issue, which is people with disabilities themselves experience some of the highest unemployment rates of any marginalized group, about 3 times the rate of the non-disabled population. Really struggling to find meaningful paid work, especially full-time work. And we know that we tend to earn less even than those with similar educational backgrounds. Do you have any ideas of how we can address the unemployment and underemployment and wage gap issues plaguing the disability community?
You know, I do. One of the things that I think has proved a problem for folks with disabilities is often they get a job and then they turn out to be the very best workers at the job. But I've had a lot of employers tell me, I would like this worker with a disability to not work part-time, but work full-time. But if they work full-time, they start to earn at a level that might end up depriving them of some Medicaid coverages. And so you end up with this cliff effect where a lot of folks with disabilities who are spectacular workers are not able to work at the level that they might want to and that their employers might want to, because they start to lose eligibility for some Medicaid benefits depending upon what their income is. So the first thing I'd like to do is figure out ways to reduce or eliminate that cliff effect, because if you have a job and you want to be able to work more and your employer wants you to, why would we have an artificial rule in place that would keep you from doing that? My staffer on who does the education and workforce portion of my agenda on the help committee, Rebecca Howard, is very focused on this issue, and what more we might do to create real opportunities for workers with disabilities. And as I indicated, I'm also trying to be really thoughtful with the long COVID community, which is millions of Americans, to really focus efforts on giving information to employers about accommodations that they can reasonably make to allow this group of workers to remain productively employed.
I'm so glad to hear about that focus. And since we have mentioned the education side of the help committee, let's pivot to think about some students with disabilities. We know nationwide, over 100,000 students in the states each year are secluded or restrained, locked in rooms by themselves, held down or physically tied down against their will. We also know about 80% of these students are folks who we already know have disabilities. But there isn't a federal ban on these practices. There has been a proposal for the Keeping All Students Safe Act that would ban the practice of seclusion and restraint other than in situations, for example, an immediate risk of harm. Would you look at supporting legislation like this or other strategies to keep our students, teachers, and peers safe in schools?
Yes, I am a proud co-sponsor of that bill on the Senate side. The House version is led by my friend, Virginia Congressman Don Beyer, but there is a near identical Senate version that's led by Chris Murphy of Connecticut, who is my colleague on the Help Committee, and I'm a co-sponsor of that bill. I think the statistics that you give are really shocking. There are rare circumstances, obviously, where a restraint or a seclusion might be needed, but in most cases, it's not necessary, and people resort to it without really doing the right kinds of interventions to help keep kids safe. So yeah, I'm a proud co-sponsor of the Senate version of that bill.
We hope to see it passed. We are too tired of stories about children being traumatized, hurt, or worse. And what we do see when tools like seclusion and restraint are used is that those children develop maladaptive behaviors as adults. And then we see people with disabilities who are arrested and incarcerated. way out of proportion with our numbers in the population. A lot of federal data says about 40% of those who've incarcerated have a self-identified disability. And so we know this is especially true for people of color, and we've re-marginalized people. How would you work on turning this trend around and making sure that we have more positive reactions to disability-based interactions with first responders?
It's a really important question. And, if you look at the instances, in the United States that have caused big flashpoints between, folks and the police, there are often instances where there is a mental health issue at the root of it. But then law enforcement officials who are not trained necessarily appropriately in dealing with mental health situations act and react in such a way that something that could be de-escalated becomes escalated, and then it becomes a huge community challenge. You see this again and again and again. There was a very, very sad case in Richmond not long ago where an individual with a significant mental disability was killed by the police. And it really comes back to we don't provide the training of law enforcement that we need to. I'm a co-sponsor of a bill in the Senate, the George Floyd Justice and Policing Act, which has a number of components to it. But one of the components is better training of law enforcement agencies on mental health issues and how to de-escalate them. And I will say, in praise of some of the law enforcement agencies in Virginia, I think they're really waking up to this. They kind of resent that society doesn't provide enough mental health funding, and then they have to be kind of the mental health responders of first resort. But they are embracing the need for more training, and I think our law enforcement agencies are getting better. But I will continue to support funding for our law enforcement agencies so that they appropriately understand the way to deal with folks who are, who need some assistance and focus because of mental health issues, but they shouldn't be treated like, felons and criminals.
We couldn't agree more all the way around. And I know Sharon, Connor, and I have been asked and worked closely with a lot of Northern Virginia first responders who don't want to be in the position of being both a law enforcement officer or EMT and social worker, right? That's not what they're there to do, and they're looking for that help. We are out of time, so we wanted to give you a minute to wrap up, and then we'll hear from Connor before we end today. Any closing thoughts, Senator Kaine?
It's really been my honor to, as I indicated before, to work on issues that matter to folks with disabilities at the civil rights level. Before I was in local government, at the local government level, the state level, and now the federal level. And it took me 4 years in the Senate to finally get on the health committee. I really tried from my very first day in. But now that I'm on it, my goal is, as long as I'm in the Senate, to stay. And I just want you to know that you've got an ally in me, in my office staff. I have a number of folks on my staff who have disabilities themselves. Their voices are really important as we grapple with important issues. My chief of staff, Mike Henry, my legislative director, Nick Barbash, my healthcare policy lead, Samantha Kohler, and my education and workforce policy lead, Rebecca Howard. We very, very much want to continue to work together. Most of our really good ideas come from you and Virginians like you. So thanks for this opportunity.
Thank you so much. We love that nothing about us without us mentality. And Connor, do you want to take us out this afternoon?
Sure. Thank you, Senator Kaine, for sharing your platform, for listening to us, for including us, and for caring, recognizing nothing about us without us. Thank you all for watching, and please vote.
Couldn't have said it better. Thank you all so much for being with us. Stay safe.